I tell the people that work for me, it starts with a smile, right? We make people comfortable. Our goal at the retail centers is truly to educate folks. That's the first step in the process. When people understand what it is that will help them pick coverage to meet their needs, I think they're more at ease with having an open and honest conversation. Our goal isn't to have someone come in and us bum rush them and try to sell them a product right away. So really that service, that friendly smile, that we're here to educate you is really our approach.
And then what about veterans? Because I know that the veterans also will maybe have some choices as well.
Veterans actually wind up having, some veterans have more options for healthcare choices, especially if they're eligible for VA services. And so all of the representatives that work for me take that into consideration when we're meeting with those veterans that do have more than the option of just Medicare after retirement.
So those could be some real in-depth conversations.
Absolutely, absolutely. I think the biggest thing that I always recommend members or prospective members think about and have somebody help them with is if you're taking any medications, that really should be the basis of where you start the conversation, because we know that prescription drug costs they can be extraordinary, especially if you're on more than 2 or 3 generic medications. The cost can really get out of control. And so what we do is we offer a service where we'll run what we call a drug cost calculator for you to show you what your medications will cost on any given plan that Blue Cross and Blue Shield offers.
Wow. And what if somebody isn't necessarily on a drug? You know, they're not taking anything other than maybe a little bit of aspirin now and then or something like that. Do they also have to sign up for that?
Well, yeah, Medicare definitely recommends that anyone who's become eligible for Medicare go buy a private prescription drug plan from a private insurance carrier. And the reason is, if you don't buy it when you're first eligible for it, Medicare has a very small window. They give you 60 days, and then they say if you don't buy prescription drug coverage within the 60 days you've started your Medicare benefits, we're going to start assessing a 1% penalty every month that you don't have prescription drug coverage. And you may tell me, Ed, I'm not going to buy it for 2 or 3 years. I'm really healthy. I don't need medications. But what happens in 3 years when you come back and you say, by the way, my doc now has me on 3 or 4 prescription drugs. I need to buy a drug plan. What happens then? That penalty gets tacked right back on because Medicare's been waiting on the sidelines for you to come back and say, hey, I need drug coverage now.
And that is the question. So what are the penalties? Because I know a lot of people when they go to sign up for it's like, well, if I don't do that, you know, there's that penalty aspect of it. And is it on the drug plan?
Yep, so there's really 2 penalties to look for when you're signing up for Medicare. One is the prescription drug penalty, which again is 1% per month for every month you don't have drug coverage and you should have had drug coverage. The other penalty, which can be much more hefty, is when you sign up for Medicare, most people aren't aware that you've prepaid that Part A portion of Medicare your whole working life. As long as you've worked 40 quarters in the US, you're eligible for Part A without having to pay any additional premiums. However, Part B is a different monster, right? Part B is an optional program that you get to opt into. That's the outpatient services part of original Medicare. You don't have to buy it, but if you don't buy it when you're first eligible, Medicare is going to assess a 10% penalty for every 12 months that you go without that Part B coverage. So if you come back 2 or 3 years later, you're talking about a premium that Medicare assesses for Part B. You multiply that by 10% for every year you didn't have coverage.
Yeah, and I think that was one of the questions that my friend who sent me a little note in December of last year, because he was at that point where he was signing up, because it's like, oh, you know, when do I have to do this? And so it sounds like, and we're going to give this number right now just in case anybody is watching and they have any questions about what we're talking about, is 1-855-579-7658. And this is kind of a general number for Medicare, right?
Any Medicare-related questions, you're new to Medicare, it's not a service line. So this is a line where you call and you say, I might be interested in becoming a Blue Cross member, but I'm really not sure about original Medicare. Can somebody help me answer some of those questions? Okay. And then maybe we talk about some supplemental coverage if that becomes part of the conversation later on.
Okay. So I'll give that number in just a second in case you were trying to write that down while we were talking here. So this is something else that when I was doing a little bit of research here, it says, why do I have to answer medical questions to get a Medigap plan?
So you only have to answer medical questions for a Medigap plan if you've missed what Medicare calls your guarantee issue period. So Medigap plans, unlike a Part C plan, you're eligible to buy a Medigap plan from a private insurer within the first 6 months you've signed up for Medicare Part B. So once you effectuate your Part B benefits, Medicare says the clock starts. You got 6 months to go buy a Medigap plan with no underwriting, no qualifications, pre-existing conditions don't matter. However, should you miss that 6-month window, you will now have to go through the underwriting and qualify, do what we call a health history questionnaire to qualify to purchase that Medigap plan. And the reason is that those Medigap plans, they're not subsidized by the federal government in any way. Those Medicare Advantage plans and Part C plans are federally subsidized. So the rules are a little different for each group of plans.
And I know a lot of people become snowbirds. So what if they miss their original deadline because they live, does it matter that they might be, visiting or at least in their second residence, I'll just put it that, regardless of what it is, and it's a different state. So do states, do you have to sign up in Minnesota if that's your primary residence, or can you, go to a different state? Does that help or not help?
Well, what I tell people is, where do you pay taxes? What state is your primary residence that you file your taxes with? That's considered your home state for Medicare, and that's the state you have to enroll for your plans within. If you're a snowbird and you change your mind down the road, you can absolutely change residency, and that opens a whole bunch of different doors that you can walk through to make some plan changes, some plan option changes down the road.
I would wonder about that, because if people are moving, just say something else happens and they decide that they're going to leave Minnesota, are the plans then different from state to state?
They are.
Oh, okay.
Yeah, and they can be extremely different. The cost can be very different. What I tell people to keep in mind is if you're looking at Medicare supplement plans have to follow the standard guide that Medicare has set forth. So if you bought a Medicare supplement plan here, and they all go by a letter. So if you bought a plan A, Medicare supplement plan here in Minnesota, you would have the same type of coverage if you bought that same plan in Florida. So the benefits are all the same. The Advantage plans do vary from state to state, and they can vary widely. You can go from a plan that's an HMO plan all the way to a PPO, which is a preferred provider organization type of plan, and anything in between.
And how is it determined what states have that? Is it determined on the size of the population of the state, or just the state governments?
So it's really the carriers, the insurance carriers,
Okay.
and what states they choose to do business in. There are some carriers that are national, and they have plans in all 50 states. Blue Cross Blue Shield of Minnesota happens to be a Minnesota-based organization, and the plans we offer are for Minnesota residents only. There are no counterparts to it in any other state.
Oh, interesting. Even though there are Blue Cross Blue Shield offices in different states.
Different plans in different states, even within the Blue Cross organization.
Oh, interesting. I had
Yes.
no idea of that.
Yeah.
Are we getting any questions online, Scott? No questions right now? Okay. Again, I'm going to give this number just in case, because we do have a lot of people that see these interviews afterwards. So again, that's 1-855-579-7658. And again, we've been just talking about kind of the Medicare 101 on that. When people sit down, again, the first one is like, do I really need to sign up for it? But what about Social Security if you have become disabled in some manner? Does that also change when you're signing up for this?
So that's another type of consumer we see walk through our door, someone who's eligible for Medicare through disability. And the way you qualify for Medicare through disability is you have to have been disabled for 24 months and be eligible for collecting Social Security disability payments. That's the requirement for you to become eligible for Medicare. If that happens, then you're allowed to look at the same options that those people who are aging into Medicare turning 65 have.